Okay, everybody, thank you for being here. I am really excited about today. This is definitely a deviation from what I normally talk about. I'm joined by Sandra Wells, and she's gonna talk to you guys a little bit about gut health, and we're gonna talk a little bit about that as it pertains to kind of some actionable advice that you guys can do, but also just to make some better, more healthy choices about your lifestyle in the same vein that I talk about with movement and what I do. But we're going to keep it mostly about the inside of your body today, with the gut in particular. So Sandra, welcome. Thank you for being here, and would love for you to give us a little background on what you do and why we're here today.
All right. Thanks so much, Tyler. So, my name is Sandra Wells. I am a pharmacist by trade. I am also a mom, a yoga teacher, a integrative health coach, and gut fitness or a gut brain guru. So that has been my passion for the last, I've been really involved in nutritional supplementation for the past 17 years, but really in the past 3 to 4 years have really started to focus on gut health and just the power of when we can heal ourselves at the gut level, just the impact it can have on not just physically, but both mentally and physically.
Yeah. And I think one of the things that really attracted me to getting to know you really was that your approach to, let's just call it internal medicine for simplicity's sake is very similar to the way that I like to approach orthopedic issues, pain. Hello, doggy. Mine's here too. It's very similar in that you're looking for the root cause. So can you explain a little bit about that? Just kind of run off of what I'm talking about here, because I think you could talk to it a little bit better than I can.
Yeah, so what Tyler's referring to is really, it's called functional medicine, is really looking for root cause of why we end up with different disease states or, high blood pressure. Um, that's the first one that comes to mind, but just a lot of things, depression, anxiety. But doctors are taught really to put a band-aid on it. The only thing that they're taught is you have this, your blood pressure's high, I need to write you a prescription, instead of spending the time with the patient and saying, what's been going on in your life? You may find out they haven't slept for 3 days, and that's why their blood pressure's up. And so if you can just back up, swim back upstream and find out why they're in the position that they're in, you can start addressing those root causes. And that, to me, is where you get the healing benefit. If you're just taking a prescription, yeah, it's going to decrease your blood pressure or it's going to help your anxiety, but it's not going to go back to what caused it,
Yeah.
if that makes sense.
Well, it does, and I think you hit a really important point, that medicine is increasingly losing, which is just the time to hang out and talk about those things and find out what may be going on with the patient. And the stress that most primary care physicians, really most doctors or people that are in hospital systems, have a high demand on seeing people one after the other in these productivity standards that are almost unrealistic to actually help people with these kind of lifestyle choices that you're talking about, not necessarily because they don't know that that's the answer, but because that, yep, there's a pill for this and that's the quickest way that I can help you. So here, bye, come back if it continues to be a problem. So again, I have a lot of appreciation for what you're doing, but it does speak a little bit to what you just said, that you called it functional medicine. And a lot of times I hear the words, holistic, I hear the words alternative medicine, just different things like that. And right, wrong, or indifferent, it gets a lot of eye rolls, both inside the medical fields, and it gets a lot of eye rolls from the consumers because they're told, that's all that integrative, all the holistic, whatever you want to call it, is hokey, for lack of a better term.
Right.
So can you kind of explain how you address that in your own field and how you see that on a daily basis and what you would like the people that are listening to know about those terms? Do you even like being called functional medicine or holistic medicine, whatever you
I,
want?
I like the term functional because I think that's what it is. It's
Mm-hmm.
gone through some name changes. It was integrative health. It was holistic health. It's functional medicine. So all of those really, to me, address the same thing. There may be some differences, but it's basically, like we said, going back and looking at root cause. And to your point, doctors don't have the time. They're mandated to see so many patients a day. If you're in traditional practice, that's all you're taught. And, when you're in med school, you're taught how to prescribe medications. You're taught these are the guidelines if you have hypertension, high cholesterol. And people may or may not know that if your doctor does not write for prescriptions when you have high blood pressure, high cholesterol, they don't get reimbursed by the insurance companies.
Oh my
And
gosh. We could
yeah,
go
and
today.
people don't, I mean, people really need to listen to this. And I always say, when you find a doctor, you need to interview your doctor. Interview your doctor just like you would anybody else that you would go to, because you want your doctor to be in partnership with you, not a dictator. They're going to say, and people are so afraid to talk to their doctors because they put them up on a pedestal, and
Mhm.
we're all human.
Yeah.
It is called practicing medicine. They are practicing. We are all practicing. Um, so I say, interview your doctor, see what they're willing to work with you on. Talk to them. Don't just rely on a prescription. If you are willing to make some lifestyle changes, and a lot of people aren't. A lot of people would rather just take a pill.
Of course.
But if you want a different approach, then have that conversation.
Mhm.
And, your cholesterol didn't get high overnight. So
Yeah.
ask your doctor, can I have 3 to 6 months to make some changes, and let's see where this ends up.
Yeah. And
Um,
and I think, you're touching on something that I think is really important, because one of the things that I will hear a lot from people um, who have been through the medical system plenty for orthopedic issues is, I don't care why, I just want the result. And my response to that is usually, well, look, I'm not explaining this to you just to make myself feel better and show you how smart I am. I'm explaining it to you because you might move very well in front of me, and you might get all these concepts in this short little window of your day that I'm explaining to you, but I'm not going to be with you when you're lifting a 40-pound bag of dog food onto your shoulder and putting it into the car, and yada yada yada. So I need you to be able to troubleshoot on the spot with some of these movements so that you can be healthier throughout the day. And I think that's something that you're kind of getting to with the people that they don't want to make the changes. They just want to take the pill, which is unfortunate. I outside of just completely changing the medical system, I don't know that I have a good answer for those people. But for the people that do, and they do want to become educated consumers of this stuff, I think one of the bigger problems is education on the fact. And I don't know that I really have a question behind that, outside of the fact that I wish there were better ways for people to get in touch with this information. And I think you doing what you do helps. But outside of that, do you know of anything where people can learn more and become more educated?
it's just and there's so much information out there. I mean, you can Google anything and find stuff. You can find pros and cons about everything, but I
Hmm.
think you just have to do your research. I mean, like I said, I work with people one-on-one. I know there's plenty of other functional medicine practitioners, naturopaths in the area that really do work in a functional medicine approach. But if you're not getting the results you want from your traditional medicine people, then I say it's time. I mean, we're all here to feel better.
Yeah.
And you don't have, I mean, just because you feel bad doesn't mean that you can't feel better. And a lot of people just get stuck in that, well, I'm on all these meds, this is the way I'm supposed to feel. But I'm telling you, if you're willing to make changes, those medications don't have to be your life sentence. You
Yeah.
can you can change it. You can come off of them. I know people that have come off 6 and 7 medications just by diabetic medications, hypertension, high cholesterol, just by changing their lifestyle and getting on a better path.
Yeah. And I think it's pretty telling that a lot of the people within the medical profession that I meet want to take as few pills as possible. I mean, it seems like they know something, right? It seems
Yeah.
like they're onto something. So yeah, I mean, I agree. I think you absolutely can make those lifestyle changes, but just as a public service announcement, and I think you'll agree with me on this, don't be afraid to learn something new and at least give it a chance, because all of this stuff is, yes, it's natural, it's holistic. um, there's not necessarily a whole lot of danger outside of spending some more time with it and learning what's going on. And really that education part of things is what's going to make you better at the end of the day, because you're going to understand better what's going on so that you can make your own decisions about your health care.
Right.
And
And
that's
it's,
what we're here to learn about today, right?
yeah, it's a choice. Yeah, you do have choices on what you put into your body, how you move your body. So we do have choices. And that's always what I want to do, is empower people to know you have a choice.
Yeah, absolutely. Very well said. All right, so getting a little bit back on track here, we're here to talk about gut health and really your gut microbiome. So can you dumb down what a microbiome is for me?
All right. So we've got actually all these microorganisms in our GI tract, from our mouth all the way through the colon, that do amazing things. So it's bacteria, it's viruses, and we actually have more bacteria and viruses in our intestinal tract than we do human cells. And the whole gut microbiome concept is pretty new. I mean, it's been around, it's been studied for about 12 to 15 years, but it's just really come mainstream in the past 5 to 7 years. And just all the science and research around it, supporting it, has really come to light. I mean, everybody knows about probiotics. Most people are like, oh, I need a probiotic, but they don't know why they need a probiotic.
Yeah.
And there's so many different kinds of probiotics out there that you really need to be educated about that as well. But the microbiome can influence, it's actually called our second brain. So we've all heard of gut feelings. And we actually have more communication from our gut to our brain than our brain to our gut. So,
Wow.
yeah. And our gut makes all these neurotransmitter hormones. So I'll throw out some scientific terms. It makes serotonin, which is our feel good neurotransmitter.
Mhm.
Our gut actually makes more serotonin than our brain does. So we used to think that we needed to treat anxiety, depression, all that with a medication.
Mhm.
And the medications are to increase serotonin in the brain. Well, if you can increase serotonin by taking care of your gut, you don't need any more in your brain. So it's just amazing, amazing science that's out there. We make dopamine, which is our motivational neurotransmitter or hormone, norepinephrine. There's so many things that our gut does for us that we just don't even appreciate. And all that, like I said, the science is really cutting edge around that. But what happens is people's guts are really damaged.
Yeah.
And so having a healthy gut, I made a post the other day, it's like having your own pharmacy. If your gut's healthy, that's your go-to pharmacy. It will make what you need when you need it.
Yeah. That's a great point. That's a really great point. It's an interesting thought. I've never heard that said before, but it makes a whole lot of sense. And especially if it has such an effect on your brain, that I think there's an increased awareness surrounding mental health nowadays, and there's a lot of great advice out there. Like we both said, you could pretty much look up anything and find some answers on it, but you have to be pretty good at picking through what's good advice and what's not so good advice at the same time. Um, and I think I've started to hear, sleep, stress, get those things regulated, but people for a while now, even before I started hearing all this information on gut health, have said make healthier choices. But that's such and I'm referring to specifically the diet.
Mm-hmm.
Um, it seems to me that is so subjective, though, and people get sucked into these sexy new diet trends. You can name off a million of them, but I think most professionals would agree that trends are exactly that. If you want to actually make a change, what are we supposed to do? Because it is so individualized. Am I correct?
It is. And because everybody's body's different, your microbiome's different. Mine's different from yours, who's different from my kids. But the one interesting thing is, and I do want to point this out, children inherit their microbiome from their moms at birth.
Hmm.
So if your mom was very unhealthy, as far as her gut health, that's the microbiome you inherited. You can change it, but that's where it starts. So you inherit your microbiome from your mom. So I'm trying to remember now what you even asked me, Tyler, because I just got off track.
That's fine. I'm just wondering, because of the subjective nature of this, what are we supposed to do as a common everyday consumer, where we're just like, I just want to make healthier choices. I don't know how, but just I would love to at least start in the right direction.
So for me, it's avoiding fried foods,
Hmm.
fast foods, processed foods. First and foremost, if you can, and I'm not saying never eat them. We're all going to find ourselves in a situation where, oh yeah, I got to run to the drive-through. Make your healthiest choice possible.
Yeah.
Avoid, this is another pet peeve. Avoid diet drinks or anything artificially sweetened. Those are chemicals. You're better off drinking if you want a soda, drink one with real sugar. I mean, our bodies know how to process sugar versus a chemical sweetener. And when we get so sucked into the calories, oh, I'm only having 1 calorie, but you're putting all these chemicals in your body.
Yeah.
So I actually, water is probably your best bet as far as a drink goes, but and then fruits and vegetables. Filling in with fruits and vegetables. I always like to say, if you put in the good stuff, then you don't end up wanting the bad stuff. So if you eat more fruits and vegetables, for me, that's what you start craving, and you don't want as much of the bad stuff.
Yeah, you're absolutely right. Because, and I'm embarrassed because I don't remember the person's name, but I can link it into this video later. But my wife and I tried to do something called the 800-gram challenge. And again, you get into fad diets, but this was less of a diet, more of a trying to start a change where, first of all, I guess this is not a recommendation necessarily. Do what you want to with your nutrition. I'm just telling you what I did. Um, but we had to eat 800 grams of fruits or vegetables every day.
Mhm.
And the idea behind it, as far as I understand, is not necessarily to get you certain micro or macronutrients, even though that's what it does, but it's to, number one, squash the snacking, because the 800 grams of fruits and vegetables is a ton. I am here to tell you, because I can put away some food, and I was having a hard time, and my poor wife, who's like half my size, was having even harder time with it. Um, but also what it does is it puts the healthier stuff in your body so that you're not going after the unhealthy stuff during the day that may give you that quick little sugar rush or whatever you want to call it, because I do believe that you should be able to enjoy eating to a certain degree.
Mhm.
But it cuts back on the excess, and we got a whole lot out of that. I think it helped change our diet up completely, so it's very confirmation of sorts to hear you say something like that.
Yeah. And then the other thing, even besides diet, you mentioned is sleep.
Yeah.
Sleep, if you cannot do anything else, if you can get 7 to 8 hours of quality sleep, that is when your body rests and repairs. And that's how you heal. And we simply, as a society, and myself included, we shortchange ourselves on sleep. We're like, oh, I can get by with 5 or 6 and be okay. It starts to take a toll on your body. So quality sleep and then movement. You're the PT. So, and it just needs to be, a lot of people don't like the term exercise. Find something you like to do, whether it's a walk, walk with your family, walk with the dog,
Yeah.
gardening, anything that you enjoy doing. Because if you don't enjoy it, it's going to be a chore, and you're probably not going to stick to it.
Yeah, I couldn't agree with that more, because I have people all the time like, hey, what kind of exercise should I do? And my answer is always, for what?
Hmm.
Because if you're asking me to stay healthy, the answer is exactly what you just said. It's what makes you happy. Because if
Hmm.
you're asking me, should I go join a CrossFit gym, even though I hate exercise? Well, CrossFit under the right leadership can be fantastic for you. But if you don't like lifting weights and moving that way, you're gonna hate it. So
Right.
you're not gonna keep up with it, and you're gonna quit after a month or so, and you're gonna feel worse about yourself and basically go, that failed. So you're absolutely right that you do need to move. And I'll even try to up somebody's step count during the day, because most people are walking around with smartwatches now, where you can see how many steps you've taken. And I'm thinking of somebody specifically right now whose problems aren't really linked to walking necessarily, but he's having a hard time sleeping. So one of the first things that I'll usually, from my end, approach is, all right, so how many steps are you getting in today? I don't care what the answer is, because I'm adding at least 5,000, unless it's ridiculously low. Because what you're telling me is I get, you know, 1,000, 1,500 steps in a day, which is not that much. My suggestion is, okay, well, we're going to dial it up to 10,000 as soon as we can, not right off the bat. But anyways, I digress. That's it's great advice, because you're right. Sleep is incredibly important, I'm sure, on both of our ends. And I told you I've been watching you speak a lot in preparation for this, and I saw you mention that losing a night of sleep is aligned with what, like 6 months of fast food. You want to
Yes.
is that, am I right?
Yeah.
That's insane. That's I really think people need to understand what that means, because that's I mean, just go watch Super Size Me if you need reinforcement on what that does to your body. It's not good for you.
Yeah.
Um, and I understand that fast food is cheap and easy, but again, time and time again, it's shown that it's really not that good for you. Um, Getting back around to kind of finding out what specifically works for you in terms of getting yourself back on track. I've seen you mention different tests that maybe are outside of the normal what you would get if you just went in and say, hey, my stomach's bothering me, and you kind of have to ask for them. um, and I'm just curious if you have any general recommendations for people who are looking to get started. I'm not asking you to give medical advice here, so please,
Right.
nobody listening to this say like, oh, all right, got to go get this. But if you're looking to make a change, what are some ways that you can kind of baby step your way into the process so that you can stick with it?
Yeah. So as far as lab tests, the one that I really harp on a lot is people's cholesterol,
Hmm.
because your regular cholesterol tests do not give you a true picture of overall cholesterol. So that's one of the biggest lab tests that I tell people. If you have high cholesterol, ask for an expanded cholesterol test, which is going to give you a lot more data. As far as gut health and just things that are going on there, my biggest pet peeve is people get put on what I call PPIs, or the purple pill, for acid blocking. You know, they'll have some indigestion, they'll have a little reflux. And again, that's the doctors are trying to get people symptom control,
Hmm.
and they'll prescribe, an acid blocker, and those wreak havoc on your body, So
Yeah.
there's other reasons that you may be having these issues. So if you're having gut issues, there's you want to be tested maybe for an H. pylori test, which is a bacteria that grows in your stomach that's not supposed to, which can cause acid reflux and indigestion. It's a pretty easy test. It does require treatment with 3 to 4 medications for 14 days, but then it gets rid of the bacteria, and you don't get put on these medications long term. Another one that is very common that a lot of people don't understand is it's a SIBO breath test. And what SIBO stands for is small intestinal bacterial overgrowth.
Hmm.
Um, I have worked with 5 people in the past 2 weeks that have positive SIBO breath tests. Um, so it's a breath test that can be ordered, but people experience constipation, diarrhea, bloating, abdominal bloating, and it's very, very uncomfortable. And a lot of the gastroenterologists don't even know or understand enough about this disease process. And it's pretty, it's pretty amazing that functional medicine has got it down. They understand it. They've been working with it. But your mainstream GI guys are like, oh, I don't know much about it. I've even had one of my clients came to me and said, my doctor won't do anything. Like he gave me antibiotics for 2 weeks, but he said, if I need anything else, that he's done. He doesn't know what to do. And I'm like, then get educated.
Yeah.
But anyway, so those are some of the GI things that I would say: H. pylori test, a SIBO breath test, and there's definitely ways to manage those. I'm happy to talk with people if they've had any of those issues, because if you've been on one of those acid blockers for years, I mean, recommendation was to be on them for no more than 14 days. People have been on them for 14, 15 years, and they wreak a lot of havoc in your body.
Yeah. And I think I mean, we've kind of touched on this before, but you're really just touching on this bigger problem that we have as a medical system in the whole, and it's that doctors basically whoever's in front of you are being paid to treat, not to assess. And without that thorough assessment, without that, these tests that you're talking about that aren't just here, let's get them done. We'll at least figure out what medication you need to be on because you have X, Y, and Z diagnosis. Um, I mean, it leads to the problem that we're dealing with right now with with the drug dependence, if that's what you want to call it, but just the treating the symptoms as opposed to the root cause and actually improving somebody's lifestyle. I think it's a shame. I'm curious if you are noticing in your profession in particular, pharmacy, yes, but also just in general hospitals, if you're seeing a shift towards this or no, not at all, mostly for the reason that I just said, because it seems like this stuff should be more mainstream.
Yeah, I'm not seeing a shift in traditional medicine, and it is several things. One is it takes probably 10 to 12 years for mainstream stuff, like all the stuff about the gut microbiome. It's
Mhm.
probably not going to make it into medical schools for another 5 to 7 years. It takes
Yeah.
usually 10 to 12 years to make it into the mainstream medical schools. And the other thing is medical schools are funded by pharmaceutical companies. So I hate to say it, but that's,
No, I mean, nail on the head.
they are funded by pharmaceutical companies. When I went to pharmacy school, I was never taught any of this. You're taught medication, side effects, interactions. And because that's what we have at our disposal, we're not really taught how to go back and really care for a patient.
Hmm. Yeah. Well, I did. So I won't name company names, but there is a commercial that I'm pretty sure is fairly famous, and most people have seen it, where the actors on there are going, "What pain?" And then they do a backflip gainer off of the top of a cliff, and then they go, "What pain?" And then they do something else that's very active, and it just shows people staying really active. And the huge bummer physical therapist in me, which I get it, I know, I'm all I ever see is people getting hurt doing stuff. Is like, oh, good, mask it, and then go do more of the thing that you shouldn't be doing. Uh,
Right.
that's but that's the reality of what we live in right now. I forever ago went on an online thesaurus and typed in the word solution, and two of the first words that came up were quick fix and band-aid, and I was like, what is going on here? That's insane that is what is coming up for this. um
But you're right. That's exactly what medications are, a quick fix and a band-aid
yeah, which
for
I
the
mean,
most part. Yeah.
makes it tough on people like you and I who are trying to institute some sort of change. But I think we're touching on some higher level stuff that we're going to have little to no control over as outside of doing what we're doing now, which is just being a sounding box for what is right in terms of how people should be treated. I want to get back to kind of self-identifying some ways to make healthier choices with your diet. I think you would agree with me that a lot of how I have to teach about exercises is that it creates this U-shaped curve of, too little is bad for you, too much is bad for you. Right in that middle there is what you need. Easy nutritional example I imagine is like vitamin C. You don't get enough, not doing well. You get too much, it could also kill you. So um, I know that a lot of people working with gut health promote supplementation because you don't necessarily get everything that you need outside of just changing up your diet. Can you speak a little bit to how somebody might go about targeting their supplementation as opposed to just going, basically being subject to really good marketing?
One of the first things I want to make sure is people know most everybody needs a quality multivitamin. Our soils have been overfarmed, they're full of chemicals. We don't get the same nutritional value, even if we ate perfectly every day. You don't get the same nutrition from your food nowadays that you did like when your grandparents were living.
I'm
And they,
really glad you said that because that is a huge hole that people try to poke in the grow your own food or buy organic from a farm down the road. Is that, yeah, but even if you were trying, the soil is just loaded with chemicals that you don't want in your body. So I really appreciate you bringing that up.
yeah, so even like I said, if you ate perfectly, you're not going to get most of the things you need. I always say a multivitamin, a quality, not your one a day. That's not quality. But a quality multivitamin is like your insurance policy. It just kind of it gives you what you need, and most multivitamins, quality ones are not going to have like 2000% of one thing. You want it to be balanced. And I'm happy to help people walk through that. The first thing is though, if your gut is not healthy, it doesn't matter what you put in it, you're not going to absorb your nutrients properly. So first and foremost, you want your gut healthy so that whatever you put in it, whether it's food, whether it's supplements, that you're getting the most from that, that you're going to be able to absorb and extract the nutrients that your body needs. So first of all is focus on your gut health. If your gut's not healthy, if you're on medications that have damaged your gut, I'm sure you see a lot of people on non-steroidal anti-inflammatories, your ibuprofen, your Aleve. There's prescription ones, but those are the ones that people can get easily. So those damage your gut tremendously.
Yeah.
They give you something called leaky gut syndrome, which I could go into a whole nother thing about that because that's linked to autoimmune diseases and a whole host of other things. If you've ever been on antibiotics, that's destroyed your gut. You know, it's killed off the good bacteria. It kills off the bad, but it also kills off the good. If you're on anything for acid reflux, your gut is not healthy. So first and foremost, get your gut health in check first. You want to get that good gut microbiome built back up, and then the quality supplementation. Some people may need very targeted stuff, but like I said, multivitamin, and I'm a big fan of omegas. Fish oil, again, quality fish oil. Don't go out and buy Costco fish oil, you know, all this other fish oil. I mean,
Dang it.
I shouldn't name it, you know, but
No,
most,
that's good. No, I want you to. That's helpful.
yeah, most of the fish oil you can find is not quality. I think there's probably one that you can buy just in a big box store that I would even recommend. And
Mhm.
most of them have contaminants in them.
Yeah.
Who needs more lead and mercury in your body? Nobody.
Yeah.
So it's buyer beware out there. And like I said, I've spent the past 17 years really researching the supplement industry.
Yeah.
And so I do believe quality multivitamin, omegas are huge for inflammation, for brain health. There's just so many things. But like I said, first and foremost, get your gut in check first. So make sure you've got a healthy gut,
Yeah.
and that there's supplementations for that as well.
But,
Um,
but you are touching on something that I'm glad because, you know, I think the good news here is I've been a little doom and gloom about how people approach medicine, but I would say that the majority of my patients that come in um, say they don't want to be on a whole lot of medications. That's one of the reasons that they're coming in to see me is because they're tired of living off of the this, that, and the other. I think the problem is they don't know what else to do, and of course, yes, I'm dealing with their orthopedic issues, but I think any clinician that is good and being truthful should know when they're over their head in terms of expertise on something else, and that they surround themselves with people like yourself or somebody that can help them out in that vein. So this is all good for me not to go back to my patients and start saying, here's your kombucha, stop complaining about this, that, and the other inflammation. It's no, here's what you need to start learning about. And I think you mentioned getting quality ingredients, and unfortunately, right, wrong, or indifferent, you can correct me if I am wrong here, but I think we got to start reviewing our supplements the way that we look up where we're going to go to dinner tonight, or look up the next big thing that we're going to buy for our house, like a sofa, or I'm trying to think of things that would have a lot of reviews. Our HVAC's about to go out, so that whole process gets to start up for me, which will be super fun. It's like buying a car apparently, but just trying to get a good review basis around this with trusted sources that recommend things. And that's what I do. Even with other health things, it's I make sure that somebody that I trust who knows more than me says, yep, this one's okay to go for. And that can be scary because, again, great marketing is great marketing. Can't necessarily hate it. You're doing a good job for what you're supposed to be doing, but you do need to be able to kind of wade through that and figure out what does work and what doesn't work.
Absolutely.
Yeah. So, that's really the big thing that I wanted you to speak about for me is basically how to target the approach a little bit better, because we talk a little bit about doing more to find that root cause, and that's the idea behind targeting, but then kind of what to look for after that in terms of the actual treatment. Because again, unfortunately, you're not necessarily going to get that with every single clinician that you go to, and you need to have at least some education in your back pocket so that you can go make the right decisions and ask the right questions in front of somebody. And if you're not getting the answers that not necessarily that you're looking for, because I have to tell people stuff they don't want to hear all the time, but if you're not getting answers um, that are addressing what you're asking, and they're saying, oh no, that's dumb, those people just hate medicine, which is not at all what you're saying, then
No.
feel free to shop around a little bit. I don't think people do enough shopping around of their healthcare professionals. But not everybody's doctor is the same thing as Forrest Gump's doctor who went and treated his scoliosis and also mama's cancer. That it is so individualized now that you need to go through a couple people to get good quality answers, or at least make sure that the answers that you're getting are quality.
Yeah. And to that point, we've got so many specialists, but your body works as a whole. It's
Yeah.
not that, you go to your heart doctor and they treat your heart. Your heart interacts with every part of your body. So it really is that more functional medicine approach that our body works in synergy. And when you heal one thing, it can have a dramatic effect on other parts of the body.
Yeah, I had a conversation with somebody that's in PT school a little while ago, and she said, "Well, I'm taking lower body class right now," and I was like, "What do you mean by that?" She said, "Well, we're learning about from the waist down," and I was like, "What? What? How? So you're telling me that if you have knee pain, you're only looking at that? That's a soapbox that I will not subject people to, because that's not what this is about." But you're absolutely right. It does all work together, which is why, on top of the fact that you do educate so much on the gut health from your very educated, very well known, very personal investment in this background, you're also a yoga instructor. And
Hmm.
so you understand that these things all have to intermingle. But like you were saying earlier, if you don't like yoga, don't do yoga. Do something that makes you happy. That's not the point at all, right?
Right.
Yeah. So, Sandra, I've really appreciated this. I know we have a lot of fun talking anytime we're around each other. So this has really been a pleasure for me. I enjoy learning about things like this, especially when I'm completely out of my element. So I hope we got in everything that you would like the world to know. But if there's something else that we haven't yet mentioned, now is your chance. Please let people know what the big takeaway is on gut health and how to stay healthy.
Yeah, I mean, I think I've dumped everything in here. It's just really, I think the other thing that I would like to say is people don't slow down enough to pay attention to how they actually feel.
Hmm.
We're in such a rush society that we shovel our food in. We eat while we're still working, and then we wonder why we have reflux and indigestion. So if we slowed down and ate a meal appropriately and reflected, well, God, how did I feel after I ate that? Or I went on a walk. How did just look at what you do during the day and reflect on how it made you feel.
Yeah.
If you had a bad day, what did you do? What changes could you have made that could have made it a better day?
Yeah. The old American expression, time is money.
Yes.
Um, look, we live in the South where time moves a little bit slower. Maybe that helps us out a little bit, but I couldn't agree more. I think we do need to be a little bit more mindful of this stuff. And that's what, again, it gets back to the people who tell me I don't care about the why, I need the results. And I'm like, well, I need you to understand the why so that you stop doing the why during the day, and you understand that the action that you're taking is building you towards a more healthy body, more healthier.
Absolutely.
Well, Sandra, thank you so much. Please tell us how you would like people to follow you, if you want people getting in touch with you to talk about any of this stuff, whatever availability that you have for people. Please let us know how we can learn more from you, and continue to learn how to stay healthy and keep our gut in good shape.
Yeah, absolutely. So if you want, you can email me at rx, the number 4, livingwell at gmail.com is an email. Or if you want to follow me on Facebook, it's Sandra Gentry Wells. You can follow me on Facebook or get me through Facebook Messenger is probably a quicker way than email, but um, or reach out to Tyler. He can get you my information as well. So I'm happy to work with anybody that's looking for a little bit maybe different answers than you're getting.
Yeah.
Different results.
Don't wait until you're in the hospital for something serious to go make these changes. In other words, start to educate yourself, start to get this figured out so that you can avoid these chronic pain issues that she's talking about, or these chronic issues. I guess I shouldn't say pain. Well, Sandra, thank you so much. This has been an absolute pleasure, and I'm sure we'll be checking in on each other soon.
All right. Thanks so much, Tyler.
Absolutely.